nearly getting kicked out of the school of pharmacy.
Born and raised in the UK, lived my whole life, and I'm a North London babe.
And for the viewers and listeners listening to this, if you don't know, she's a graduate of Imperial College.
Down to my upbringing, Mum did a really good job of making sure that, yes, we are British. However, if you go down to the root of things.
So in the UK, ethnic minorities experience worse outcomes in nearly every major long-term condition, from diabetes to maternal health. Why do you think health systems have struggled to close to this gap despite the decades of effort?
In a lower sort of socioeconomic household, went to a state secondary school, in environments particularly where you wouldn't necessarily see individuals who looks like you pursuing careers like medicine, becoming a doctor.
Research actually shows that 70% of global health leaders are still men, which is according to a research that WHO actually did in 2023. Yet, you have become a powerful female voice in medicine and public health. What moment pushed you to become and go beyond your clinical work into global advocacy?
The NHS is one of the most diverse workforces in the world.
And it's even the biggest.
It's so... the competition doesn't stop when you're trying to even just get in. Within the environment itself, survival of the fittest.
Hello viewers and listeners, welcome back to the Shelf Conversation podcast. You already know that all the time we bring amazing guests, and today my guest is also another amazing person, and you can't wait to actually let me introduce her. But if you haven't subscribed to this channel, please make it a decision to please subscribe and share our videos and join the community, because we are building one. Today, my guest is Dr. Khadija Owusu. She is an award-winning medical doctor, global health advocate, and social impact leader. She is the founder of the AKAYA Foundation and a founding member and trustee of the Melanin Medics and an ambassador of the Cuba Enterprise. A proud British Ghanaian, Dr. Owusu is a powerful voice of equity in healthcare, education, and gender empowerment, and she is championing Black and ethnic minority medics and inspiring thousands across the world in education and also in equality and inclusion. Through AKAYA, she has led impactful programs for girls across Ghana and beyond, advancing health education, leadership, and safe spaces for younger women to thrive. A Forbes Africa 30 Under 30 honoree, Diana Award recipient, and TEDx NHS speaker, she has been recognized by Her Royal Highness Princess Anne for her contributions to STEM and has taken the stage at global platforms including the United Nations and even the White House. So without much ado, help me welcome Dr. Khadija.
Hey.
Wow. The profile was actually profiling. How are you doing?
I'm good. How are you?
I'm doing well by God's grace. How was the day today?
Not bad.
Yeah.
I just had a couple meetings, phone calls, and now I'm here. I've been looking forward
That's
to
what your
coming.
life is all about. So without actually wasting much time, your story has actually been impactful. I am actually a benefit of you sharing your stories online, and it has helped me to actually take my advocacy and my relations to Ghana very, very, very serious. I was born in Ghana, but going back to actually help is something that I didn't know how to navigate back.
Yeah.
But you have always told the story as it's supposed to be. How did you come back up with that? How did you come up with that?
In terms of going back?
Going back, reconnecting to the roots. Because you were born in the UK, isn't it?
Born and raised in the UK, lived my whole life, and I'm a North London babe.
Tottenham?
Yeah. Yes, that's typical. That's where you find all the Ghanaians. It's like a mini Ghana. But what I always say, it all stems down to my upbringing. Mum did a really good job of making sure that, yes, we are British. However, if you go down to the root of things, home is Ghana. Yeah. So growing up, we would always make the trip back down to Ghana every 2 years during primary school, secondary school. So we quickly knew as, children growing up in the UK that Ghana is also home. That's where we are from, that's our ethnicity background. So paired with also being, in a way, indirectly forced to learn the language. We are kind of still pretty much a no English household.
And I'm going to test you on that.
I should have kept my mouth shut. So yeah, like she made sure, like she's like, English you can learn at school, but at home you must learn the tree. So again, that also, you know, took part in shaping us really having that love for Ghana. It got to the end of secondary school where she gave up and she was like, listen, if you want to go back to Ghana, go and pay for yourself.
Yeah.
Once you hit the 12 years old plus, you're an adult, and that plane ticket price is different. So I took quite a long break, almost 10 years of not going back at all. I really wanted to, but it was just a case of, okay, finish medical school first before you go back. And as soon as, I didn't even wait for graduation. I said, as soon as that final exam was done, I'm going, I'm doing my medical elective there and then seeing what happens. So yeah.
Fantastic. And you've actually worn the crown very, very well, because you have not actually shown that there is a gap between Ghana and UK. You, before we started this conversation, I was like, you should be made a diaspora ambassador of Ghana, because literally you show Ghana in the way that even people who grew up over there, they didn't actually see some of the gaps.
Right.
You were able to seamlessly do it, and it's not like you've been appointed to do it. It's just you actually connecting home, and well done for that. Thank you very much. And that was just, by the way, that was not even the starting of it. So research actually shows that 70% of global health leaders are still men, which is according to a research that WHO actually did in 2023. Yet you have become a powerful female voice in medicine and public health. What moment pushed you to become and go beyond your clinical work into global advocacy?
I think so. This is a really good question, actually, and I think it stems even further back before starting AKAYA. Melanin Medics. I think around the time when we started, realizing that, you know, this is a cause that we're so passionate about when it comes to representation, diversity in medicine, for medical students, doctors, but it just goes also beyond that towards our patients and the communities that we serve. So I guess that's where my sense of being drawn to public health began. And realizing that, okay, I'm becoming a doctor, and I'm, you know, trying to save lives, impact lives, change them for the better with the one-to-one engagements that we have with patients on the ground. But I think my purpose as a doctor goes beyond the four walls of a consultation room. And that's advocating for our people, especially Black, African, Caribbean communities here in the UK, tackling some of these unfortunate health inequalities that we experience. And then, you know, navigating and doing the work that we do through Melanin Medics. I got to a point towards the end of medical school where I was like, I love doing what we're doing here in the UK, but I personally also see my impacts going beyond the UK, global. And if I'm starting anywhere else outside the UK, it has to be Ghana. And doing those kind of first few pilots of the work that we did in Ghana made me realize that, wow, there's a lot more that needs to be done. And that's pushed me more into global health as well.
Fantastic. And you're doing well as well. Thank you very much for the work. And for the viewers and listeners listening to this, if you don't know, she's a graduate of Imperial College when it comes to global masters in public health, which is what I'm actually pursuing. So
yes. How's that going?
It's going well.
Yes.
It's going well. Done my first exam, and by God's grace, it was quite of a journey, but thank God I'm actually getting the inspiration, because if you've done it by combining with full-time work, why not? I'll be able to do it as well. So thank you very much for sharing with us. And also, studies actually shows that Black women in the UK are 4 times more likely to die in childbirth than white women. How has your British Ghanaianness or identity shaped the way you approach health inequalities and representation in healthcare?
I think it has shaped me in, I guess, not just in an amazing way, but also in a realistic way, in terms of understanding that I do have some lived experience. I can relate to some women who are going through some of these inequalities, and then also understanding that realistically speaking, I could be one of those statistics, which also makes it a bit more like, wow, this is something that we need to work towards changing.
So you practice with empathy.
Right, exactly. So that really fuels me in terms of wanting to continue to speak up for what we do, continuing the research that we do within Melanin Medics, continuing the advocacy, and seeing what else we can do to change things.
Awesome. Thank you very much. And it's rightfully said, because with me, I always tell people that coming into healthcare was something personal. It was not about, I don't even see healthcare as a profession. I see it as a calling. Because sometimes the sacrifices you have to make, it requires more than
average.
The time, the money. We don't look at it. Not saying that we are not getting paid. I'm not saying that. We're getting paid, but what I'm trying to actually say is, you look at the way certain patients or clients will treat you. If you are not really deeply rooted in the profession, you'll be like, I'm out.
It's true.
I'm just out. Because the sacrifices, the abuse that we don't talk about behind what is happening behind the scenes, sometimes even as you doctors, as it's come series of times on the news, asking for increase in pay, people on other social media trying to justify and belittle the effort that we play. And it makes you feel like you're the patients that I'm trying to make sure that I'm in the right position to serve you. You guys should rather be fighting for me, but you're fighting against me and be on the side of the government. So I always say this, and that is something I can actually relate to what you actually said, that we could actually be on the other side of the statistics. So it's been that kind of mantra that if I'm in the position of making a change, I will do it, so that if I'm on the other side of receiving it, I wouldn't start complaining. Because when I was giving it, what did I do?
It's
so
true.
So you've rightly said it. And also in the UK, ethnic minorities experience worse outcomes in nearly every major long-term condition, from diabetes to maternal health. Why do you think health systems have struggled to close to this gap despite the decades of evidence?
This one, I think, and this relates to a patient that I saw the other day as well. This is heavily multifactorial, I would say. Already we know our systems were built not in a manner that is able to serve different kinds of populations, different communities, different cultures, different groups. Fine. But also, as much as we understand that fact, we're getting to a time where it can no longer be used as an excuse. Because it's 2026. We've been knowing that, our populations are becoming more and more diverse. So what are we going to do to fix the system? And one of the key areas in which we can do is making sure that our leadership is reflective of the population that we're serving. Our workforce, the NHS is one of the most diverse workforces in the world.
And it's even the biggest.
Exactly.
I believe,
And so it's not a matter of having more of us on the playing field, let's say. What about as we climb up to the top, we're noticing that there's less and less and less of us. And the top is where all the decisions are made, all the recommendations, all the policies. And if there are issues pertaining to a particular population group that are brought up to the top, and individuals are not able to relate or even strongly advocate for those issues, it will then lead to a place where there is a lack of perception, because it doesn't really affect me, so what can I do?
I fire up, right?
Exactly. And that's why we need more of us climbing to the top to make sure that we bring these issues to the forefront. That's one of the main things. And then another thing also is, which I will kind of say is a bit of our fault.
Tell us.
Our culture.
Tell us about it. What have we done?
Was it 2 days ago? My clinic, 60-something-year-old black man comes in. What did he come in for? I can't even remember. It was either back pain or shoulder pain. And then I just did a general vitals check, measured his blood pressure. Systolic was like 160 plus.
Jesus Christ. To my listeners and viewers, if you don't know, 160 is emergency. It's emergency. And I believe he argued with you.
Bless him. He was such a lovely guy. And when I was like to him, he has high blood pressure. It's on the record. I said, did you take your medication today? He said, no, like, I just rushed out the shower and I came here for the appointment, blah, blah, blah. I said, clearly, that's why we're seeing these numbers.
And he doesn't even pay for the medication.
So then he made this really good point towards the end of the consultation about, just how, we really need to take care of ourselves. In my head, I'm thinking, okay, 100%. But you didn't take your medication, but fine. And he said, it's not when you go, it's how you go in relation to passing away and obviously eventually dying as humans, which will happen, which is so key in the sense that a lot of our communities, yes, life can be stressful, overwhelming, expensive, headache. When it gets to those moments, our health just down the list. And it's little things like missing your medication, saying, I'll go next time, or I'll book the appointment and then you don't book the appointment. I need to go for the health check, but then you don't end up going for the health check. Little things like that, which will pile up. Maybe you have some underlying symptoms that you're like, it's going to go away, but it doesn't go away. When you present yourself, a lot of the times for us, it's too late. And when it's too late, it's so much more difficult to treat.
It's true.
So it's so important that we take our health seriously. Any little thing, any change, we know our bodies more than anybody else. Any little change, we present ourselves to the healthcare professionals that are able to help us. So that's one of the other ways which I think it goes hand in hand. Systems need to be able to be more equitable for all populations, but also we need to understand that we are our biggest advocates. And we have to make sure we fight for our own health.
Fantastic. As Dr. Kelly said, we have to make sure that we fight for our own health. So if there are anyone listening or watching this particular episode today, one thing I want to ask you, when was the last time that you even walked into the pharmacy to go and check your blood pressure? When was the last time that you felt a certain pain and you became so curious that this pain is unusual, so let me take the time out to go and investigate what it could potentially be?
It's so much worse in Ghana.
I'll come to that. I will come to that one. My Ghanaian audience, wait for me. So sometimes it's not every headache that you may think the paracetamol is going to actually treat. Sometimes it might be that kind of stress you've been going through might be causing extra stuff within your brain. I don't want to actually scare you, but sometimes that is the worst it could actually be. Some people might end up developing a tumor in the head, but they don't even know. They think it's just normal headache. So please, let's respond to our body as doctor advised. Make sure that we are our biggest advocate. The GPs may say it's nothing, but until it's resolved, you need to cooperate with the GP to make sure that we get to the bottom of it. And coming to the Ghana one, honestly speaking, this one, I'm guilty of it, but I have to share it so that anyone who is listening to actually would actually take note of it. So I went home doing one of the, I think it was December, and every time I go home, because everybody knows that I'm in the field of pharmacy, they would start coming with their medicines and everything. Sometimes too, I become curious and I check up on them.
Right.
Have they taken their medication? Only to find out that one of the blood pressure medications for, I think, my sister or my cousin or my auntie, she was taking it when needed. But there's a caveat. And with Ghana, the reason why some people have started doing it is it's expensive. The medication is too expensive that some people are trying to reserve it only during emergency. And I said that emergency, God forbid, could be a stroke. Because if your blood pressure is not well it's not well taken care of, it could be stroke, or you could actually have a cardiac arrest and even pass away. So I advise them that please, it's advisable that you take it not when needed. Take it every single day. It's a regular medication all the time. Book appointments. If you need review, make that kind of decision. If you think it's expensive, there's a range of it. Some of them might come as generic. That could actually help. But, sometimes some people lie to you that, if it's generic, it's not going to work. You have to take the branded, all because of business reasons. So I took time and explained to them, they monitoring their blood pressure, even as down as their diet. And I believe you actually testify to it, how right now a lot of our community in Ghana are switching to more of processed foods than home cooked meals, because some people can actually eat oily food in the morning, afternoon, evening, and some of them are not even actively, burning all these kind of calories that they actually end up putting in. And eventually you see a young person at the age of 30, they've developed high blood pressure. Then I'm like, where did we go wrong? So it's not only a UK kind of problem. It's more of our community as in Ghana, and it's something that I don't know. We've been candidates of public health. I think there's a bit of work that needs to be done over there, and that's something that with me I'm planning to do. What can we do to help? Because if there are preventative measures we can use to reduce the number of people who end up developing the condition for a long period of time, then we need to do it. We need to intensify the education. Growing up in Ghana, public health used to be very intensive, that every single moment there's an advert that is showing one condition. When HIV/AIDS was very, very prevalent at the highest, they were showing a lot of adverts, educative programs. But right now, all of those have minimized. I'm like, the government or the Ministry of Health needs to, step up and make sure that, because public health is the backbone of healthcare.
Honestly,
it is.
And in contexts whereby you're not necessarily a high income country, you cannot have a lot of a huge burden of people developing different diseases. I mean, the issue with kidney disease and dialysis in Ghana and all of that stuff. You practically can't have so much pressure on your secondary, tertiary care because you can't handle it. And so that's where prevention and primary care needs to be so much solidified. And with the nature of how people are, especially in low-income settings, for example, like Ghana, over December we did a community health screening in partnership with Afrofuture.
I saw it.
And we had we had some of the market women and just general community members coming in, and one lady, I mean, I'm complaining about 160 here in the UK. Hers was over 200. Sister.
Someone has told me that thing before. The pharmacist had to stop. He says, please, we need to take it to hospital ASAP. No. He says, if anything, if I don't take it to hospital ASAP, the next moment, they will say, oh, there was nothing wrong with him and he died. And that thing, always I tell people, I say that when someone dies in Ghana, we are subject to it that, oh, they were fine. I said, no, the symptoms has been it has not been dormant. It's been ignored. Then the moment that they die, we go and do autopsy and realize that they had an underlying condition, but they never knew anything about it.
Honestly, we were like, hold up. Okay, we have like a portable ambulance here that can take you. This woman, as soon as we gave her the consultation, she started to walk off to go and join her other group that they were doing some other event separately. Nothing. And we were like, please, this is so serious. You can literally have a stroke any moment. Please, we need to at least just take you to the hospital. You have your IV antihypertensives. Come back and continue your business. This woman said no. We tried to speak to the people that she was with. No. And some of the doctors, some friends who are doctors in Ghana were like, Doc, this is our everyday. You see how you are so anxious about this woman. This is every day. And I was like, wow, this is something. So we need people who are able to directly communicate and engage with all these various communities, because it's still that whole respecting your elders or community elders is very much deeply ingrained within Ghana. And it's like anything the lead says, will go. So it's seeing how we as healthcare professionals or the Ministry of Health can collaborate with these local community leaders in order to pass that education on so that we take our health more seriously.
Fantastic. Thank you very much, Doctor, for actually sharing this, because I thought I was the only one who have actually witnessed it, but I think it's something that it's a conversation that we can continually do whilst we are back at home to make sure that people do understand the impact. Sometimes they even make the excuse that, oh, I've been having this for years, it's not been treated and I've been surviving. I said, yeah, but that is just by chance that you are actually alive. It's just by chance. The fact that the stroke hasn't come because you have actually got a blood pressure of 260 doesn't mean it will not.
Exactly.
And unfortunately, if we don't treat it, as you said, in lower income countries, what tends to happen is that the amount of money that could have actually been saved on treating long-term conditions, we end up doing it. I don't want to even go to the far of even WHO coming in, lending us money. And I'm like, the cycle will still go on. If we don't treat the common goal of people not taking their health serious, then we risk of actually spending a lot of money. But anyway, the King's Fund reports that Black patients are 40% less likely to receive psychological therapies, but are 4 times more likely to be detained under the Mental Health Act. What does this tell us about the structural realities of health equity?
I think this is similar in terms of, when you ask me about the system.
Yes.
This point again goes both ways.
Yeah.
I think a lot of us still somewhat perceive some of the healthcare services available to not necessarily be for us. It's not really accessible. That's what some of us really think. And so we believe that maybe it's because of the fact that it's not accessible, it's not really going to accommodate to us. And so what's the point in trying? They're not going to listen to me. How can they help me? The other side, or the flip side also, is, again, our traditional beliefs of therapy. What's therapy? What's therapy gonna do for me? I don't understand. It's not gonna help me. And maybe for a bit of the older generation, in still perhaps maybe believing like mental health is not a thing. Go and pray. So it's really a hand in hand thing. I think it's the part of making sure, which I think we're going in the right direction. We're seeing a lot more mental health care services that are a bit more targeted for our populations, even ourselves, setting up our own sort of therapy and consulting, counselling services as well, from people that maybe have a bit of a lived experience or can somewhat relate, because sometimes it's much more easier to open up to somebody that can have a bit of relation to what you are going through. And then us opening our minds up to understanding that there's a reason why these services are available. It's for our benefit, and there's no harm in trying. And as much as prayer is key, we must also utilize the services that God has provided for us to receive and seek help from. So definitely that's what I would say.
Fantastic. Definitely, that is what Dr. A is going to say. If you're still listening and you're still watching, this is the Shelf Conversation podcast. So why don't you subscribe to us? Why don't you join the community if you've actually enjoyed the conversation from the beginning to this stage? And if you have missed any part of this episode, please go back, start from the beginning, and continue to the very end, because there's a lot that we're going to actually talk about, and I believe that you're going to actually benefit, and you're going to learn a lot why certain things actually happen in healthcare, and how certain issues can go a long way to actually affect the well-being of a person. So stick with us and follow us till the end of this conversation. So, Doc, let's move a little bit away from the healthcare, because that's one side of you. Now, let's jump into your girls' education, which you are really much vested in and takes a lot of your time whilst you're in Ghana. So the United Nations Educational, Scientific and Cultural Organization, short as UNESCO, it reports that when a girl receives just 1 extra year of education, infant mortality drops by up to 9%.
Wow.
How has AKAYA used education as a public health intervention in Ghana and beyond?
Ooh, how?
Your baby.
Right? Various forms. So, and I think our programming, in a way, kind of touches the different angles in which we utilize education to help with public health.
Yeah.
So, if we start right from
When did you even start?
ooh.
For the sake of the viewers, because I've actually sort of the journey, so I might know. And
So the year I finished med school was 2021. That's when I started the whole journey of,
wait, 2021? 2021. I think that's the same year that I finished my pharmacy school as well.
Yeah.
Yeah.
So the journey started in 2021, but officially we registered December 2022, and I guess came out to the world as AKAYA March 2023. So
What does AKAYA stand for?
So AKAYA is a combination of two Adinkra symbols. One is Akuma, signifying heart, love. Then the other is Aya, and Aya is the one that's like the fan, which means endurance and resourcefulness. And I think I'd said, like, even in our mission, is, you know, to build the next generation of African female leaders, but I wanted the name to have its origins from Ghana. So the combination of those two symbols, I thought, really signify and embody women in general, having a lot of heart, a lot of love, also the hearts relating a bit to medicine with the doctor hat, and then just women in general going through a lot, having to endure, but still rise. So that's really the meaning behind
Fantastic.
AKAYA.
And you've done a lot of projects like Project SC. You guys have built a school. Fantastic.
Thank you.
Well done. You guys are actually doing amazing.
Thank
and
you.
One would actually ask, based on what did you, I know you've talked about going back to Ghana, your mom always taking you and your siblings back to Ghana when you guys were young. And when you finished med school, you decided that you will actually see yourself more over there. Did you experience any form of, let's say, inequality when it came to education that really inspired you to help other young ladies to persevere through their education?
Within Ghana?
Within Ghana, no, in your life in general.
Yeah. I would say, so growing up in a lower sort of socioeconomic household, went to a state secondary school, in environments particularly where you wouldn't necessarily see individuals who looked like you pursuing careers like medicine, becoming a doctor. And I used to have the mindset of maybe thinking that, okay, this environment can potentially be a bit limiting.
You're right.
I loved, like, honestly, my time at secondary school. I love my secondary school so much. And they've played, that time period has played a key role in who I am today. But I think it really taught me a lot in then understanding that, okay, if I don't necessarily see individuals who look like me, I don't necessarily have those role models or mentors, I'm gonna try my best to not let that deter me from wanting to pursue this dream that I've always had. So I transitioned into getting a scholarship to a private sixth form, which really opened my eyes to seeing the two sides of the education system and realizing how there are so many young, capable people, smart, even more intelligent than I was, who are Black, ethnic minority, just like me, coming from not much, who miss out on some of these opportunities because, number one, a lot of the time we tell ourselves we don't belong or we don't qualify. Meanwhile, we more than qualify. So we miss out on having these amazing opportunities. Another thing also is because we don't see ourselves there, we're not even going to try. And so I wanted to make sure that that gap is bridged, which led to, I guess, a lot of the work that we do at Melanin Medics and providing that extra medical application support for the aspiring medics who don't necessarily have the perks that a private sixth form will give you, that I maybe received, to bridge that gap and making sure that, okay, you can still, fulfill that dream of yours too. And then I guess, going to Ghana and realizing that, okay, the struggles are similar but also very, very different. And more so on a much worse basic level, to the extent of not having sanitary pads, which, you know, as a result of that, you're missing out on school.
Yeah.
The hours piling up, you're falling behind. Do you then, how is that affecting your progression through school, through high school? Eventually, if you do make it to university, your level of intelligence and being able to make it through, and then obviously this is a whole nother hole that we can go through, but in terms of, you know, traditional educational systems, are you really prepared for the working world? All of those, I guess, areas in which we plug in at AKAYA with our various programming, and so those are the issues that I saw within education that really fuel what I do.
Fantastic. That's really inspirational. And I've seen some of the people that you don't just help them with education, but you help them to find internships. And I've seen the stories. If you don't follow AKAYA, please make sure you follow AKAYA Foundation and support the work that they're doing. You're getting a lot of massive support from contributors and collaborations as well, which is really, really great, because I believe a lot of people have got to see the reality when they get to actually visit Ghana or any parts of Africa, that there is still a need whereby there is someone who might be at the age of 14 but have not got access to education, but it's not like they're not intelligent, but because of some of the challenges they've actually faced, whereby education is not free, and accessibility itself is actually a difficult task because there's a lot of them, so you have to rush to be able to get it. So you are making a life-changing impact in Ghana. And you made mention of menstrual education, which is a research I did. It states that in sub-Saharan Africa, 1 in 10 girls misses school during menstruation due to stigma and lack of resources. Why is menstrual education and access to safe spaces so crucial in shaping a girl's long-term health outcomes?
Yeah, it's so important. Like, I think it's, as you mentioned, the earlier statistic in terms of, you know, the impact that it also has on infant mortality and improving that as well. There's a saying, and anytime we usually do our school visits, I love the fact that the girls even know it themselves in terms of what they say about when you educate a man, you're educating an individual, but when you're educating a woman, you're educating a whole nation. And it's true, because the little knowledge or information that you empower this young lady with, it has a ripple effect.
You raise a family with it.
Yeah.
And raise a community.
Entirely. There you go, honestly. And information, as, you know, when it comes to menstrual hygiene, in the sense of, okay, we've noticed that there's a gap in the knowledge that the schools are actually sharing with the girls. Because when we do go in, we're trying, it's a matter of understanding, okay, what do you already know so far? And we determine where there are missing gaps and fill those gaps. And sometimes it's even down to a bit of the basic science behind menstruation. Then even now coming onto the hygiene aspect, even hygiene aspect in terms of, you know, cleanliness, sanitation, but also what to do when you are on your menstrual period, what resources are available, what resources shouldn't you be using, because obviously, understandably, with the lack of funding or lack of having enough money, some like toilet roll, rags or whatever is what some of these girls are resorting to. But through our interventions, we're providing them with resources that make sure that for at least next 3 years you're good. And then also there's the part of some challenges relating broadly, more so speaking, to women's health. A lot of these young ladies will have tons of questions. We try to make sure we at least have, if it's not our experienced menstrual health educator and the lead of our Like Her project, Maud, we have healthcare professionals on ground, whether it be from the diaspora or from in Ghana itself, who are there to really advise these ladies. Because we get questions like, you know, is it normal that your period should be this painful? Is it normal that I have my periods twice a month? Is it normal that I'm not having my periods? And these are really, really important things that these girls need to know. And not even forgetting the myths that still exist maths?
There's some
Can
madness,
you
yeah.
drink cold water on your periods? All of those kind of myths that exist that we then need to demystify and stuff. So it's so important, and making sure that we then give the girls these resources. You stay in school,
Yes.
you get the education, you are not missing out on the hours, the key hours. You progress through, the education and eventually employment,
Yes.
and being able to look after yourself, your family, and that whole cycle.
Fantastic. And as you made mention that if you actually educate a woman, you educate a nation, one of the things that drew my attention to it is if menstruation during menstrual period is not taken care of, it's also a point of them catching an infection, and it could even affect their childbirth, or even complications in their marriage and everything. So menstrual care is really, really important, and it's something that it should not actually be ignored. Every particular government or every particular organization needs to really take account into it. And I think recently, I don't know if it's been enforced, there was this conversation that was raised when Ghana was reading their budget that they're going to actually provide free sanitary pads. And even global health citizens, global health actually, global citizens, that's a global health citizens. Global citizens actually applauded Ghana for it, because right now, currently, globally, everyone is wishing that their government actually do it, because the thing is, it's not, a woman didn't actually force themselves to actually go through this kind of pain and menstruation. So why should they have to pay for this amount of money? So sometimes I discuss with the nurses in Ghana, some of them who are actually advocates. I'm like, have you tried contacting these corporate organizations to try and collaborate so that they can provide it? It says, we've done everything, but they don't seem to understand. So we have to use our own money to buy these sanitary pads and give it to these young ladies for free. So it's something that I would entreat, coming from two global masters in public health candidates. It's something that we would entreat, that if any nation is trying to do anything to help ladies, please take that into consideration to provide the free sanitary health, because it goes a long way to help with the health outcomes for ladies. So we started our conversation talking about your role in Millennium Medics and representation. Another research I did, it states that only 6% of UK doctors are black, yet black medics report the highest rates of workplace discrimination, which was a report that was done by the General Medical Council in 2023, which is an issue that you've actually touched on in your platform, such as TEDx NHS. Why is representation in medicine not just a diversity issue, but a public health necessity?
I mean, I guess what you, touching on my TED Talk in terms of, the very title in itself is Representation Creates Medicine That Saves Lives. We are constantly hearing day in, day out of cases of, individuals of ethnic minority being mistreated, not heard,
overworked.
Exactly. When, even just from the patient perspective, when they are seeking healthcare. And so you really think back to who are the individuals providing the care that these patients are receiving, and understand that, I guess, if there was more of us within the system to provide that listening ear and a bit of empathy and relatability, some of these issues wouldn't really have to exist. Ethnicity, studies show that ethnicity is one of the most common reasons as to why NHS staff are discriminated against. And sometimes I sit there and I think, is where somebody comes from. Just that simple fact is why we are, being mistreated.
Sometimes they even question your knowledge.
Honestly, it sounds very, it sounds so stupid when you really think about it. And it's so sad. And, we often think that it's the patients that are being rude, racist, whatnot. A lot of it sometimes comes from our colleagues as well.
Yes.
From my personal experience, it's mostly colleagues, especially when I was a junior doctor working. It was mostly colleagues where I would feel some type of way, whether it be the microaggressions, unconscious bias, and I think. What we do really well at Melanin Medics is we have our allyship and advocacy workshops that we deliver to medical schools and some NHS trusts, where we're really honing in on the fact that just because somebody may come from somewhere else that's maybe not the UK, it doesn't mean that they are less competent than you when it comes to the medicine or whatever healthcare practice they are working within. Nor does it also give you the right to speak to them in any other way that's quite disrespectful.
Yes.
So it's also about being able to understand how your language is very important, checking yourself when it comes to the bias that you may unconsciously be bringing, and avoiding letting these stereotypes that can often be reinforced by media, whatnot, avoiding letting those stereotypes affect the healthcare that you then provide to your patients, because it's life-threatening.
You're right. And in any environment that someone from an ethnic minority or from the black community does not feel confident in practicing, it subjects them to actually making a lot of errors. And in healthcare setting as well, you already know that any little error that we make, there's nothing like a little error. Any error can, as little as not calculating the dose right, can go a long way of causing a lot of issues for the patient. So imagine that the pressure is there of them not fitting that they're welcome and they actually making an error. It goes a long way of them even start being truant, because any error they make, they have to slide it under the carpet, because they don't want anyone to see it, because if it gets said, they're going to be picked on. So thank you for shedding light on it, that it goes beyond just the patients, but our colleagues are also a contributing factor.
Right.
You made mention of Melanin Medics, and we started talking about it from the beginning of this conversation. And it's been a pioneering organization in advocacy and also in helping other young people from the black and ethnic minority when it comes to navigating their way in medicine and also getting to the medical school. But there's one funny fact. Do you know that I was around when the idea of Melanin Medics came? We were at the AKAYA Foundation.
Yeah.
And I remember Olamide was in the same, we're in the same cohort, but we're in the same group. So I remember I heard something about Melanin Medics, and I forgot the name of the doctor. There was another doctor who I was on there with. And when I saw Melanin Medics, I was like, this was an idea that these young ladies talked about it whilst we're in AKAYA, and today it's blossomed to actually cater for 100,000 plus young people across the whole of the UK. So that's something fantastic that you guys have actually done. And you make mention that you guys have brought about systematic change, such as the advocacy that you guys do. How has that actually helped with leadership when it comes to young people in medical school?
Oh, next year. I think it's next year is our 10 years.
Wait a minute. Let me calculate. Next year is
2017. Sorry, 27. 2027. Yeah.
Yeah, I think you guys are right. Because I think it's around 2017, 2018.
Yeah.
Wow.
So,
a decade.
Crazy stuff. We have come a long way, and shout outs to Alamade. Incredible force. Honestly, like my sister. How have we, our work spans from, outreach, to the going into the schools, which is and that's even just showing that these young kids that, if medicine is a career that you would aspire to be in, don't let the fact that you think maybe there are not enough black doctors deter you.
Yes.
We are here to show you that we are actually indeed medical students, we're doctors. If we can do it, you can too.
Do it, yes.
Through to providing our application supports, whether it be personal statement, reviews, interview support, and also our mentorship program where you are paired with a current medical student to help and guide you through that process. And understanding that the issues, the discrimination doesn't even just stop at you trying to get into medical school. When you are in medical school, it's a whole other issue. And I'm seeing it a lot on my social media in terms of the young guy that passed away in University of Birmingham.
Leicester. Is it Leicester?
Birmingham.
Is it Birmingham? From Leicester.
Crazy. Who committed suicide because I think he failed the resit.
He failed a resit and they told him to withdraw.
From medical school.
I've been in that position before,
Wow.
not contemplating of suicide,
Yeah.
but being at the position of nearly getting kicked out of the school
Yeah.
of pharmacy. And around the same time, there was a young lady who was approached Dental.
Mm-hmm.
And Dental did well by screenshotting
Mm-hmm.
the conversation. The guys, what advice can I give to this young lady? She's going to medical school,
Mm-hmm.
final year. She did. I don't know about the receipt policy in Ghana, but she was in her final year, and she failed that final exam. And they told her that you can't become a doctor.
God.
And she is contemplating on taking her life.
Mm.
So immediately she came and said that it really woke up the senses in me that yours is not that bad.
Yeah.
Someone has thought about taking their life because
Yeah.
everything is crashing on them.
Yeah.
There's hope.
Honestly.
And it's sad. I've said it time without number, and it's something that I actually went back to my uni trying to work on how School of Pharmacies and School of Medicines, we create unnecessary pressure. We understand it's hard,
Yeah.
it's high demand,
It is.
but at the end of the day, we preach about mental health in these institutions, but we don't take care of the people who are there.
No.
And in my situation, I said how exam results are communicated is in the poorest state. If you know the student has not attained the mark, call them back. Call them into the office, sit them down. Because imagine how, as a medical doctor, you are breaking the news to someone, unfortunately have to live with a long-term condition. You wouldn't tell them on the phone
No.
or post a letter.
It's true.
You bring them
It's
to
not
your
how you teach
office.
us.
You bring them to your office, sit them down, break it, ask them, is there anyone else you feel comfortable being in this room? Because we need to discuss the
Yeah.
outcome and how we are going to. But they just drop it on you and
Email or
goodbye. Just
That's it.
email, you open your email. I remember
That's it.
when I received the message that I had to retake my year in third year, it made me sick.
Wow.
That one was even an error. There was an error in between. It made me sick until my my lecturer came back from a holiday. She came to find my email because I was like, okay, they said I need to retake this particular exam. What support can you give me? It says on my sheet, you got the second highest. So I got 92%. So how did 92% become a fail? Then they said the one who input the results made that error. Then I said, so what if I made a decision that, you know what?
That's it.
That's it. Like on my grave, it's like you got 92%. I'm taking my life. So I think if there is anyone in the position of power anywhere around the world, medical school, School of Pharmacy, School of Nursing, please, and even in general, how results are communicated to students should be taken into consideration, because it's not a punishment that someone has actually failed. They should not be punished for it. They might have been an underlying factor, but it looks like the moment you fail, you become an enemy.
Yeah.
And you need to be treated as an outcast. So I was like, what's the point? And I hope that this young man's unfortunate death could actually bring some
It
form of
serves as a wake-up
reformation.
call, because it's honestly
It's
so
unacceptable.
sad. And the thing is, when you hear about these cases, majority of the time what I've heard or individuals, friends or whatever, tell me about these cases, ask them by how much they failed. This gentleman's case, it was either 0.5 or 5%.
Jesus Christ.
It's always so close, and you feel the need to then eliminate or like stop the entire career journey that is yet ahead of them. It doesn't make sense. But you want to sit down and then be like, okay, well, it looks like black and ethnic minority students are more likely to fail their exams. What are you doing about that to bridge the gap?
They're doing nothing. My year group that I was supposed to graduate from in the School of Pharmacy, in the history of the School of Pharmacy, was the highest fail rate.
Wow.
Yeah. We failed abysmally. Not just fail like a bit of mark from we failed abysmally. And the uni didn't take time to even investigate. We had the highest number of applicants of extenuating circumstance, and one of the highest reasons, I believe, was people complaining about their mental health. Nothing was done. Oh, there's this department, go speak to them. And I said, we are healthcare students and we are being trained to actually take care of ourselves.
Yeah.
Meanwhile, this is how we are getting treated in the School of Pharmacy. How are we going to help the general public? So it is something that I believe that it's a conversation that needs to continue being had, and we hope that there's going to be a form of reformation.
Definitely.
Yes.
And I even just want to add in terms of, like, we are, I don't know, the medical school environment is so, like, the competition doesn't stop when you're trying to even just get in. Within the environment itself, like survival of the fittest.
I think we need to have another episode that
right?
I will bring medics, School of Pharmacy. We will sit down and we will actually express our grievances of what we've been through, because there's that common denominator that passes through every time. It's like, you need to survive here, so you have to spend all your time in the library.
Right. But I also think it's also an individual issue.
Yes.
We have grown up most of our lives, especially, those who are entering within the healthcare field, you've grown up most of your life being top of the class. Yes. You're used to a certain standard. Yes. You're used to a certain expectation from yourself. When you enter an environment where everybody is now the top, unfortunately somebody's gonna have to be at the bottom. But when that hits you, I remember that hit me in, like, was it first year medical school? I said, oh wow,
oh my days, how did I get here?
My head that was so big has shrunk.
You've been humbled.
That's the word. I was humbled with a capital H. However, what you then have to use that, turn that into is a stepping stone. How are you going to adapt the way in which you're used to studying within this new environment? Because medical school is completely different. You will have to change your learning style, how you're going to revise whatever, and make sure that you implement those measurements early enough so that it's not a last minute thing, so that you can do well. However, I think what we need to understand is, as long as you're passing, no matter what grade you are getting in medical school, especially now in this day and age where a lot of that there's a lot less pressure to be having top all the time, because when you go into specialty training, a lot of the specialties are not even looking at what particular grades you got during medical school. Exactly. And we also need to understand that somebody could have done extremely well in medical school, somebody could have done average. At the end of the day, the doctor sitting in front of you, the one that did average, is probably a much better doctor than the one that was a robot. Medicine is beyond, or even any healthcare professional, it is beyond the grades, the academics. How you relate to people, how you communicate. That empathy is not something that grades will buy you. So we really need to let that sit in and understand it.
Preach. Thank you very much, Doctor. And hammering on how medicine needs to see beyond the grades. And there's something that I've seen among the people who completed the same medical school that you went, which is St. George's. And I've seen that, especially, I've seen one male who actually completed it. But every single person who went to St. George's comes out to be like a voice. I can count on top of my fingers. I can count you, Dr. Liana Mite, Dr. Ya, Ohima Benkun, Dr. Jessica Katanga, Dr. Marlon. The list can go on and on and on. What is special about St. George's University? Tell me. Because you are the second St. George's University graduate that has actually come on my podcast. And I see the kind of heart that all of you actually carry. It's like you've carried the community on your back. What goes on over there?
Ooh, what goes on? I don't even know. But, I wouldn't say George's was...
Have you seen the trend though? You've seen what I'm talking about, like... I
didn't really think about it like that till
really?
You mentioned.
Okay.
Yeah.
But for me not going there, when I sit down and I look at it, I'm like, wait, and even I've had one of my colleagues who went to St. George's University and he came out and I'm like, what exactly is St. George's University? Because compared to other other school of medicines that I know of, St. George's University actually really stands out. Maybe it might be my observation. I'm not trying to be biased, but it is what it is. All the people that I know who are doctors, who I've actually had relations with, has been because you being Forbes 30 under 30 Africa, Marlon being Forbes 30 under 30 Europe, all of these recognitions actually sum up that there's something that you guys are actually doing.
Yeah. I think, as much as I think George's, I always say, my 6 years of medical school, I loved it. But it wasn't extraordinary. I think what I would say is probably, I would commend some of the staff members at George's who were, especially working within the EDI department, and they were extremely supportive of some of the things that we wanted to champion as Black medics, and even extremely supportive with, Malone's Mind the Gap and the Black and Brown Skin Handbook. And I even remember the day, was it on evening? I was in the library revising for my exam, and Malone came up to me. He was, bless him, honestly, I'm so proud of him. He was telling me about this idea of he wants to get these different pictures of black skin conditions, blah, blah, blah. And I was just like, wow. And then COVID hit, and I remember speaking to him, and he was like, no, I'm sitting on this information that's really going to save us, blah, blah, blah. And the uni aren't really listening to me, but I feel like I want to release it. I'm not going to wait for anybody, blah, blah, blah. Then he released it, and then world takeover. And I was just from one conversation in the library this to world takeover. Crazy. And it was especially also the support of, shout out to Margot, shout out to Ban from St. George's, who really supported in making sure that our voices were heard. With the Black and Beyond campaign, with our images.
I saw that one.
The other day, when did I last go to George's? September. Still there.
It's still there.
4 years later.
Okay.
4, 5, I can't remember how many years later. Which is crazy. And yeah, I think George's really gave us that environment to stand for what we really believe in. So yeah.
Thank you, St. George's, for giving us some of the amazing doctors in the UK. And after that, after the recognition, I believe it might be your recognition for Forbes 30 under 30 Africa, you get to actually address the audience at UN. If you could actually bring a reform, one global health policy today, particularly for girls and young women, what would it be and why?
Oh my gosh. Oh. Damn. Ooh, a reform. I think, okay, I always go with two key areas that require a lot of priority. As you said, young women and girls. And when it pertains to young women and girls, I will more so broadly bring it as childhood and maternal health, broadly speaking, in terms of making sure that its education is a mainstay, not even throughout, the academic schooling system, but also generally speaking, in terms of, national advocacy and national communications that is spoken about within different countries. The other thing also is primary care. In terms of what I was saying about these countries are not able to withstand the pressures that will come if there is imbalance leaning towards secondary or tertiary care. Hence, we need to make sure that our primary care is solid to reduce that future burden. So, and in primary care being solid, a lot of it relates to childhood and maternal health education. So I think the two go hand in hand, and that's where I would say needs to become an emergency priority.
Thank you very much. I wish that we had a lot of time to actually discuss a lot, but hopefully there should be a part 2.
Yes.
Fantastic. So the closing part of our conversation, evidence actually shows that when girls believe in their potential, health outcomes improve across generations. If every young Black girl across the world could hear one message from you today, what would it be?
Oh my gosh, pressure. Oh, one message. What would it be? I always say one key underlying thread that goes through all the messages that I always share is for individuals or young people, young women to keep going. And when I say keep going, I mean it with as much realism as possible, in the sense that you keep going regardless of your background or your environment and the limiting factors that it may present itself to you. It doesn't necessarily mean that you must still box yourself within those limitations. You have every right to break free and go above and beyond. But when you do go above and beyond, you keep going in the sense that there are other people looking behind you, looking up to you, that you also need to carry along with you, so that you don't go forth on that journey alone. And when you are gone, there are people behind you that you have helped to continue to succeed, and keep that cycle going. The other thing is to also keep going, but understand that we are human.
It's true.
You will have days where you just can't be bothered. This January is coming to an end, but since coming back from Ghana, work is still going, but like it's been quite a nice, slow January, lots of rest, whatnot. And so understand that you are human, your mental health matters, take care of yourself. And whatever you put your mind to, go ahead and do it.
Thank you very much. Wherever you put your mind to, go ahead and do it. This is where time will allow us to have a conversation with Dr. Khadija Owusu. I've not done this before, but I just want to start with you. If there's anyone that you recommend to come to this podcast, who would it be?
Oh.
Healthcare related?
Yeah.
Global health?
Oh.
In the space of change advocacy? Who would you want to see over here in your seat?
I would say my sis, Dr. Joyce.
Dr. Joyce?
Yes.
The challenge is on you, Dr. Joyce.
She can bring a bit of Nigerian flavor.
So wherever you are, Dr. Joyce, can you make it happen for us?
I can reach out to her, yes.
Thank you very much.
Anybody else? If you haven't already, Malone will be it.
Malone, we are still in conversation.
Yeah, okay.
I'll drag you from where he is and bring him here. So thank you very much, viewers and listeners, for sticking with us to the very end of this conversation. This is where time will give us. I know there is a lot of Dr. Khadija is a repository of knowledge and experience, and we could go on and on and on. But this is where time will give us in this particular opportunity that God has given us. So continuing subscribing to this channel, and please make sure that you share this episode to others, because it will go a long way to help and reform some of the policies that we want to actually see. Until then, stay blessed. Thank you.